So let's talk about co-occurring disorders, or also known as dual diagnosis treatment, and let's talk about what that is and then how we go about working through that at the sanctuary. So co-occurring disorders it's exactly what it sounds like, that I have typically a mental health related issue, anxiety, depression, post-traumatic stress disorder, and then I have some substance use that goes along with that. And dual diagnosis means that we've recognized and are treating both of them together. And actually this has become much more common than it used to be. Most, I would say, of the people that come to the sanctuary have more than one thing going on. Because if we look at people that present with addictions only, well, we're looking for the root cause. Why are we abusing drugs or some kind of chemical, even if they're prescription drugs? Why are we doing that? There's always a root cause. And so therefore, even a straight up addiction we treat it as dual diagnosis. So, and if we also look at people that come with just straight up anxiety, depression, most of the time, even if it's not a severe substance use, they're doing things to soothe that pain, to soothe the discomfort, which will create some imbalances in their life. So it might not be a straight up addiction, but there's going to cause some imbalances. So we have to look at all of that as well. And when we just look at basic mental health issues like anxiety and depression, they are classified as mental health issues, but they're also symptoms of something else. Why are we depressed? Why are we anxious? What's going on? And this stuff is mostly in our unconscious mind. So the analysis of that, we treat that as kind of a dual diagnosis. And so we go about treating that in a holistic way. If we look now, research has pointed to the fact that anxiety and depression have a cause. Their root is in inflammation, not a co-occurring inflammation. The inflammation happens first, and inflammation is typically something that is from my environment, the food, something I'm taking into my body, or in a stress situation, cortisol, very inflammatory. So we have to manage inflammation. So gut health becomes really important. The things that we eat, repairing the brain. So everybody has some brain damage, particularly people that have depression and anxiety. Affect the brain. They affect cortisol. The brain is not meant to be bathed in cortisol, so it will really affect the hippocampus, which is our learning center and the way that we if I can't learn new things, it's harder to reframe them, to look at them a different way, to heal them. So we help people with brain repair protocols. So you can get the brain going, get the gut going. Then we do the kind of deep psychological work to get to the unconscious programs that happen, the unconscious constructs that people have about their lives. It's not what happens to us, it's all the decisions that we make, all the choices then that we make after that. Hey, I have to be more defended, I have to be more protected, I'm more careful, all of those things. That's what we need to get to, and all of this stuff resides in the unconscious mind. So, we have a lot of therapeutic interventions to actually dig that out and bring it conscious and present so we can heal it and work on it. And most people that have come to the sanctuary have had the experience of sitting with a therapist and they'll come up with some great ideas, and I'm going to go home and I'm going to do A, B, and C. And 2 days later, they're not doing A, B, and C, they're doing E, F, and G. And, everybody scratching their head and we just get more and more frustrated. Well, it's not my conscious program that I need to get to, it's all the unconscious stuff. So we have to work on that. Then we look at the domain of the soul and how that affects us. And in asking a lot of people what is the soul, many people have all kinds of complicated answers or no answer at all, but everybody agrees it's our truest nature, like our most authentic self. And when we get disconnected from that because of trauma or because of some kind of abuse or to try to fit in or to get love or a job that I need to get that's not in alignment with me, we get further and further away from who we really are. And we believe that's a big cause of sickness. If I'm not true to my authentic self, how am I ever going to be right in the world? And so we go about treating that, and there's all kinds of interventions just for the soul. You know, we have a whole webpage about it. And then finally, we talk about spirit, which is our connection to the greater field, which we get through our own energy body. There's a page on that as well. But we're picking up information kind of like Wi-Fi. So we're like Wi-Fi receivers, and the Earth is putting out a Wi-Fi signal. And when that field gets distorted, the signal gets pixelated, and I'm just not picking up the clear signal. So I don't trust my intuition, my interpretations. I'm not connected to the bigger picture. And so we heal all of those things in a very specific way to heal co-occurring disorders.